So we have with us here Dr. Kofi Dalrymple, the Managing Director for a newly launched medical health service company, OnCall Medical Solutions. Um, can you explain more to us what is it that you do? I know you're offering new services in terms of telehealth and concierge medical services, but can you explain more as to what this entails?
So we are a company that's formed by um, Guyanese, local Guyanese, who are mostly in the medical field, healthcare providers. Most of them are doctors and a couple of nurses. I am the only non-medical person on the team. I'm an engineer with a PhD in engineering. We see ourselves as a technology company, a technology platform. And so essentially what we're doing is, on the one hand, there are patients all across Guyana who need access to healthcare. And then on the other hand, there are healthcare providers all across the country. And the current model for most people is, if we need access to healthcare, people often wait until they're very sick for an emergency, and then they'll rush to the hospital. So for example, if you are in, I don't know, South Georgetown, and you need access to a doctor, we believe you shouldn't have to leave South Georgetown and go somewhere. If there's a doctor who's your neighbor, what if there's a doctor passing through South that could actually go and see you? And so what we're doing is creating a technology platform that's able to connect those patients and those doctors. And that's at the simplest level how we're working. We're not an emergency service. So for example, if someone calls with an emergency, we would refer them still to the ambulance service.
Will the company be working with any specific hospital in terms of a patient needs surgery or any further medical care?
Now, I want to expand the service. This is something that we do have in our plan. So we've started to build our network, and so for example, we've sat down with a private lab here in Guyana, and we've talked about how we can integrate their system with our system. And so one of the services that we can offer, we do offer, is, for example, coming to a patient's home or office to be able to take a blood sample if they have to. So if you had to do blood work, you'd go to the lab and you'll wait and you'll stand in line and they'll pull the blood work, and then it'll get submitted and you go back and get your paperwork. Well, we want to move away a little bit from that and offer this convenience that, well, call us, and if you have to do blood work, we can send someone, right, a phlebotomist or a doctor, to come out, take that sample and actually take it to the lab, and then you'll get your results. And so we're building an electronic medical records system. We've got an app for this. So the patient's information goes into the app, and then we're looking for ways to connect that app, for example, with the lab. We started to talk to other businesses, for example, that's doing something like Meditaxi, that's moving people around. And we're starting to talk to pharmacies and local private clinics where patients can go there and either meet our doctors or meet other doctors.
With everything revolving around the COVID-19 pandemic, will OnCall Solutions be offering COVID tests?
Yes, I'm glad you said that, because I just did mine today.
Okay, can you tell us a little bit about your team, the team of doctors or nurses you have on board,
Yeah.
and whether this service would be available to persons countrywide, patients countrywide?
As long as there's a doctor in any part of the country and there's a patient there, we're going to go countrywide. Yeah, so people can contact us. We do have a website. It's oncallguyana.com. That's OnCall, ONCALL, Guyana.com. So folks can go to our website and check our website out. And of course, we'll be adding more and more things to the website. We can also be emailed at oncall@oncallguyana.com. That's oncall@oncallguyana.com. We can also be reached at 624 OCMS. OCMS as in OnCall Medical Solutions, so 624 OCMS, which is 624-6267.